we have the third speaker, Dr. Sirenda Vong.
I want to thank the organizers for inviting me. But before I get started, do you mind me asking who you are in terms of audience, as to whether you have any, let's say, public health background, or you've heard about AMR before? Could you raise your hand if you have heard about AMR before? Okay, that's fine. And public health background? Any public health? Medical background? Okay. So you're familiar with the theme? Most of you.
You want to ask who is not familiar with AMR?
Yeah, I'm scared of asking, which you've been in very bad shape. How many of you have never heard about AMR? Okay. Are you familiar with the notion of surveillance, for example? Okay. Good. Yeah, that's the one. Sure. Okay, so I was asked to talk about surveillance of AMR in Southeast Asia. So basically, I mean, for you, it's South Asia, but for WHO historically, it was named, this region was named Southeast Asia versus the Southeast Asia, the official one that is called Western Pacific region for WHO. So we're going to focus only on our region, so South Asia. So I was asked to talk about challenges and opportunities for surveillance. So let me get started with how I'm going to use this presentation. You know, you're familiar with our region, you know, as WHO. So this region is about 11 countries, 1.9 billion people because of India, Bangladesh, and Indonesia. If you put those three countries, it's 95% of the population of this region. But we have only 11 countries, and it's a small number in terms of the number of countries compared to other regions in WHO. But because of these three countries, it's an important region. So I get started with why do we need surveillance. I hope that you hear me well. Huh? So okay. And where we are in terms of surveillance, and what's next in terms of opportunities. I think Dr. Clara has introduced to you this milestone, which is the Global Action Plan. For those who are very much interested in AMR, I really advise you to read it. It's a very comprehensive explanation of the issues and how to handle it. Of course, it's a global document, but it shows the complexity of AMR. And I insist on the fact that AMR is very, very complicated subject. And I hope that you'll get a sense of it when we go through those slides. And you could see in Dr. Clara's presentation that it's huge. You don't know where it starts and you don't know where it ends. But I want to mention the fact that Global Action Plans it's a milestone. It has been adopted by the World Health Assembly, the WHO World Health Assembly in 2015, but it was also endorsed by FAO and OIE. Are you familiar with those organizations? FAO is basically Food and Agriculture Organization. It's part of the UN, and OIE is an acronym in French, but it's basically the animal. It's a WHO for animals. So. World Animal Health Organizations. So why is it important? Because this action plan was endorsed by all countries that are member states of WHO, and it says that countries need to develop their own national action plan to combat AMR, but aligned with the Global Action Plan, and the Global Action Plan gives directions how to do it. and insists on the 5 strategic objectives that I will show you in the next slide. And the 5 strategic objectives, if you read it carefully, it covers everything, and everything in terms of complexity. So the 5 strategic objective was also showed by Dr. Clara, was the fact that you need to raise awareness, the understanding of AMR, because it's very complex, and we know it's very low across the world. The second thing is about surveillance and research. So I'm going to insist more on surveillance, because surveillance is essential because you need to show the data to see where you are. And the problem with surveillance on AMR is that we don't have much data, and I'll show you later. The second thing is about the incidence, reducing the incidence of infection, meaning that if you have less infection, you don't need to treat with antibiotics. So vaccination, for example, could be a mean for reducing the infections. So people won't have infection or fever. They would be less likely to be treated with antibiotics. Optimizing the use of antimicrobials is really the area of Dr. Clara's, so something that she already showed. And of course, the other part was ensuring sustained investment. This is something that I can explain later. It's a complex issue that is not well understood by countries, but basically it's about countries to come up with their own data to advocate for more funding and resources to combat AMR. And this is also a main gap. So the guiding principle for surveillance is, I want to focus on surveillance. It's too small to show, and I put it in circle in red. We have in the Global Action Plan 10 work streams. And the 10th work stream we have surveillance, but instead of surveillance in 3 work streams in here. Basically, it's AMR trends, antibiotic resistance trends. What does it involve? We all know, you read in newspapers that AMR is on the rise, meaning that the resistance is increasing. But actually, if you look at the data itself, you don't see that. You don't see that much in the newspaper. It just says, oh, it's on the rise. But I'll explain this later. The second point is that when you do surveillance, and this is very unique to AMR surveillance, is that you need to look into or monitor also the volume of the use of antibiotics. Meaning that you want to know whether by reducing the use of antibiotics, you'd be able to have an impact on AMR. And the third thing is about One Health. So I don't know whether you're familiar with the concept of One Health, but the point here is that if you look at the bigger picture, 70% of the production of antibiotics in the world goes to the animal sector. It's not the human sector that is using most of the antibiotics. It's the animal sector, because you need to feed the animal, but of course protect them from infection. But that's an exaggeration of the use. It's just that a lot of people in the agriculture sector would prefer to give antibiotic before infection happens, so that those animals will be protected against infection, and they will be able to grow, and then you'll be able to sell those animals more easily. So the point is that they use also antibiotics for not the right reason. And that's where also you have that AMR that is on the rise. Okay, so just to insist on that. Second principle is that WHO cannot do it alone. And I would go beyond a little bit, in fact, but most importantly, our close partners are people from OIE and people from FAO. And of course, the thing that we have to do is that if you want to move all together, it means that all countries has to get involved in AMR. If the weakest link is only the reflection of the difficulties in AMR, because if everybody is moving forward and one country is not doing anything, there will be a source of resistance for across the world. So this is a global issue. Now, it's unfortunate you can't read it in blue, but just to say that AMR surveillance data is complex. It's complex to collect, but more importantly, it's complex to analyze. Because we're not talking about, if you take another disease, whether it's respiratory infection, pneumonia, or you take dengue because it was mentioned, or cholera, or whatever disease that you have, encephalitis, You can count the number of cases. It's easy, you will understand that. But how do you do it with AMR? So we just say, oh, this is the level of resistance for that antibiotics against that bacteria. But how many bacteria are we dealing with? So how many antibiotics are we dealing with? You know, and what type of infection are we dealing with? Is it blood? Is it urine? Is it respiratory infection? So when you put that together, we're not talking about, oh, we have 5 more cases this week for this disease. It's just that, how do you express that to the public to make them understand that it's a problem? And I like the example that what Dr. Kyle was mentioning. You know, this is typical of the problem. She was saying that, wow, it's a problem. But she came up with an example that, oh, a friend of mine had, a friend of a friend died because of a superbug infection. But how do you sell that idea of the rise of antibiotics to the public or to other professionals when you don't know how many people are dying of it? And we don't have that data. So we come up with something like this, very microbiological, the level of resistance. But how people don't understand that concept, it's not very clear. So just to explain how complex it is. Raising awareness is fine, it's very easy to say, but how you do it, this is more difficult. Of course, I'm not talking about the lack of resources in terms of funding and issues related to money. Of course, we're talking about clinical demographic data, so all that thing make it very difficult to analyze. And surveillance is about collecting data on the trends of AMR, but collecting data to analyze it. But when you come to a country like India or Sri Lanka and you say, what is your national data on AMR? How do you start with that? I will show 5, and this is 8 priority bacteria. It's not only the only ones. I will show the level of resistance to this antibiotic, and I'm putting up here more than 50 antibiotics. So it's very difficult to communicate something that is important. Okay? But you know that, we know that from the data, but I'm not showing you because that wasn't the point of the presentation, is that is on the rise. Meaning on the rise by the fact that if you don't have penicillin, you don't have antibiotics like the one that the last resort, you would not have anything to treat against common infection. Your skin infection that you have it, and if it becomes fever generalized in your body, you would always have the resort to go to a doctor, and if doctor can treat you with something that against staphylococcus, for example, and it's sensitive to the antibiotics that you use, it's fine, you get it. But if you don't get that kind of, and you have resistant bug, you will die for skin infection. Something that happened like 50 years ago before penicillin. And this kind of the threat that is becoming global, and that's the major issue for it. So it's just to show that it's how complex the problem is. Now, as I put it up to you, the problem is big. But when you get into talking about tuberculosis or MDR tuberculosis, for example, it's easy. I can tell you that the incidence of tuberculosis is on the rise in certain part of India because we count number of cases. But then if you talk about AMR, it's very difficult to share that. And here, what WHO is doing at a global level. And I said it to you, let me start with the red box. This is something that WHO has started at a global level. It's called the Global AMR Surveillance System. It's, in short, basically an IT platform to collect all data across the world. Why is it that we want to do that? Because we want to measure trends. We want to know whether this year, the data that we have from countries, several parts of the world, the data we have, that if it's accurate, how is it going to be in 10 years? Are you able to have some data that shows it's on the rise, or is it reducing? And the question is that when it is reducing, the next step is why. So you want to measure it with the use of antibiotics. You want to know whether by reducing the use of antibiotics, or not reducing, but having a better use of antibiotics, you'd have an impact on the rise of resistance. Okay, so AMR, the GLASS platform, is supported by FAO, OIE, and WHO, but with the center that is centered by WHO. But when I talk about GLASS or global surveillance, it's not AMR only. It's also the monitoring of the use of antibiotics. But the complexity is that you're not doing AMR only in humans, you have AMR in animals and in environment. Another sector that is something that we don't know much about. And then when you measure AMR, the level of resistance in those three sectors, you want to measure also the consumption of antibiotics, but not only in humans, you have to do it in animals and in the environment as well, because you may not know it, but some countries are using antibiotics in plants, you know, to preserve the production of the fruits. So it's really something that is a major issue. On the country level, what is advocated, and you could see, you can't see it from here, but I put up pictures of reports from WHO. So basically on the left, Dr. Clara has shown to you that the global push is for countries to build a surveillance system that is integrated, meaning that when you build AMR surveillance, you don't do it in human also, you do it in animals and you do it in environment. You can imagine environment is something that is much behind. And the animal sector is much behind also in the human sector because we don't have that system that is solid enough, and actually the methodology is not clear yet. And then in the animal sector, OIE has come up with a database that is a global database collecting data on consumption. But it's very challenging because they don't know how to collect it and what kind of methodology to measure it. You know, when we talk about volume of antibiotics, the volume for one antibiotic doesn't mean the same thing for another one, because it's about the principal active compound that is in antibiotics, that you don't need that much milligrams to make it efficient, and you take another antibiotics, then the milligram that you're measuring is different effect. So if you put that together, how do you measure that? So you see the complexity of the system that we're trying to implement at a global level. But the push for the national level, from the global level to the national level, is that please measure your AMR in humans, but also measure your AMR in animals, and measure your AMU, which is the antimicrobial usage, something that was presented earlier. Now, challenges with a focus on surveillance. When you talk about AMR at a higher level, let's say government level, there has been a lot of progress. Before, it was considered a public health issue. Now it's no more. Since 2016, it was brought up at the General Assembly of the UN, meaning that it's no more a public health issue, it's the global health security issue. Meaning that if we're getting into that kind of unchecked situation, it could disrupt the societies and the world, because you would have an issue of how you're going to treat people with antibiotics that are no more effective. So that's the reason why countries at the UN, now at the UN level, they say it's a problem of security of the world. It's climate change, for example, and it's very rare that you bring up at that level a public health issue. And WHO with of FAO and OIE was able to bring that at a very high level. Now, that high level commitment is there. But when you get into the awareness of people about AMR, for the public, for the professionals, for other sectors, even for medical doctors, when you look at the data, it's very low. Of course, it varies a lot, but it's very low because it's very complicated to communicate. And more importantly, and I put in here, we don't have any data. When I tell you about TB, I can tell you that, oh, we have that number of cases, the incidence are very high, and then and I can tell you that if we're doing that way, the program is working, the incidence is falling in some areas of the world, so it's working because we have data at the beginning and we have data at the end. For AMR, we only have very few areas of the world that have data on the burden. And the data on the burden I didn't show you here because that wasn't the purpose of this presentation, but you may be aware, we only have 3 areas of the world that have data on that. The US, obviously. Europe has come up with some assessment of the number of deaths related to AMR, and it's a very difficult methodology as well. So something, and Thailand. You go to India, what's the burden of AMR? How many people